Hello and welcome. I am Cyril Stober. Nigeria has kicked off its vaccination program against the ravaging COVID-19. It started with frontline health workers and then the country's leadership with President Buhari and Vice President Osinbajo leading the way. Today, we will examine the place of vaccination in stemming the spread of this pandemic. My guest is Professor Abdulsalam Nasidi, a virologist and pioneer Director General of the NCDC, that is the Nigeria Center for Disease Control. He is the Vice Chairman of the FCT COVID-19 Ministerial Expert Advisory Committee. Professor Nasidi, thanks for joining us.
My pleasure. Thank you for having me.
All right. Well, the vaccination has started. After all, the delays and the anticipation, it's kicked off. But let's start from the basics. In dealing with diseases such as this, why is vaccination necessary?
Well, I will have to say we have to congratulate humanity for now having the tools to be able to quickly not just identify the disease, but identify the cause of the disease. So, in medicine they say if you do proper diagnosis, that means you have virtually cured the patient by 50%, if you know exactly what is disturbing the person. So, in the past, we do have such outbreaks, pandemics, epidemics, and it takes a long time to establish what is really causing that outbreak. Was it bacteria or virus or something else, and so on and so forth. But with the technology development worldwide, we are now capable to quickly identify the disease, characterize the disease, and also identify the pathogen or the cause of the disease. So in this case of COVID, it is in history of medicine one of the fastest ever that a new pandemic or epidemic has broken out within a short period of time. The cause of the disease, which is the COVID virus or SARS-CoV-2 virus, was identified, characterized, and the information about the virus dumped in the global gene bank. So the whole world now have the virus and know even the gene component of the virus. So that is really history. With that, it means that we can quickly develop, the tools to fight it, weapons to fight this disease. The first one is develop drugs that you can use to, checkmate the multiplication of that virus in human body. The second one is to develop the diagnostic tools, the kits that you can use to quickly diagnose and know, is this man having this symptom? Because there are other diseases that give symptoms like COVID, especially in the tropical area. Fever, headache, difficulty to breathe. These are common diseases that some of these diseases that are occurring worldwide, particularly in the tropics, give. So is it caused by the COVID virus that you've already identified? So that one is good to get the test kits. Then the last one is to be able to prevent it effectively. And the best way to prevent the disease most effectively is to develop a vaccine that you can use. There are other tools, the non-pharmaceutical that we're already knowing. But the best one is to get the vaccine specifically against that virus and use it, to immunize people, and the people are protected. It's cheaper.
Right. You see, I said starting from the basics of why vaccination is necessary. There's been the old age argument about vaccination, immunization, that it is basically introducing into an otherwise healthy body a virus in the hope that it will trigger the body's defense mechanisms, the immunity to fight it. Now, there's been arguments over time over that why introduce something into a body that's healthy, and what if it fails?
Well, that is the question. But we have organizations in the world that will never allow that you introduce a virus or whatever that you call vaccine into human without them checking it. That's why you have each country has its NAFDAC equivalent, Food and Drug Authorization Authority. Then you have the WHO. Then you have regional group like the European Medicine Agency, and so on and so forth. So all these regulatory bodies will never allow that you use a vaccine or a tool for prevention that you put in humans that could fail easily. That's number one. Number two is that, the fact is there's no way they will take the same virus, and just put it live inside your body. It's true that the vaccines that we are using, they are derived from the COVID virus itself. It is either it is a killed virus, like the Chinese are using, or it is a modified virus, live virus that has been weakened, and it can cause, stimulate antibody response if they put in your body, or they use particle of the virus, like most of the COVID-19 vaccines are now. So these are the issues that it's not possible to put a virus or vaccine into the body that we know that will fail. It might not be as potent as we want it to be, but at least it must have been tested rigorously before it's allowed to be used for mass vaccination.
All right, and then it brings us to the question of vaccination, the efficacy of the vaccines themselves, and what kind of protection they're capable of providing.
Okay, so the key is when a vaccine is developed, there's need to quickly establish the quality of the vaccine. Does it contain those components that you say you are using for the prevention, for the medicine? So that is what they test in phase 1, and is it, you put them in animals, preclinical, does it cause temperature, does it really have ability to stimulate antibody? So now the next one is to now establish, is it efficacious, is it, so that means you will now have to show that out of the 100 people that you gave the vaccine, you understand what I'm trying to say? Within an area where the virus, the wild virus is transmitted, 80 people are protected. From 60 to 80 to 90, or even at times 100, depending on efficacy, effectiveness of that vaccine. So in this case, you have to get that result to show that out of the 100 you have immunized, a particular amount are protected. That's why you see the different vaccines are given different protection level. AstraZeneca 62, Pfizer BioNTech 92, Sputnik 5 91, etc., and so on and so forth.
Right. So there are a number of vaccines now out there, not just one. So let's zero in on the one that's been used in Nigeria, AstraZeneca.
Yeah.
Okay. It's been said that it is probably not as potent as the other vaccines, and there have even been suggestions in the public space that Nigeria probably went for it because it was the cheapest, so necessarily it's the least effective. How would you respond to such concerns?
That's very unfortunate, because Nigeria wouldn't have actually gone for any cheap vaccine that is not effective or efficacious. The first thing is that, the AstraZeneca that was tested, was produced in Europe. That is the initial one that gave the 62% potency level. And then, after that vaccine is produced, they made sure that it was high quality, efficacious, and then effective and safe. So they now thought, the factories in Europe can't produce enough to meet the world demand or the world market. So they now decided to do contract production. So they're now producing in India and also producing in South Korea. And this contract, production will bring down the price a little bit. So the second very important point is the fact that, we have two pathways for you to obtain this vaccine. Take your money, go to the manufacturer and buy. That's what the rich countries are doing. And many other developing countries that have big population like ours, they go and buy. So in this case, you decide which vaccine you want to get. The other version is that you go in through the multilateral. So now what we are using, Nigeria is using, is what they call the COVAX multilateral, which is organized by or coordinated by WHO. You have Gavi and other multilateral organizations. They say, look, many developing countries don't have the money to access this vaccine. So let's come together, find a way to raise loans, raise donation, etc., and buy these vaccines for them. So this is the pathway through which Nigeria has obtained this vaccine now. So it's a donor vaccine. In that case, Nigeria doesn't decide which vaccine they are getting. It was decided by COVAX. And how can COVAX decide to get you the right vaccine? If they are getting through multilateral, COVAX has said the vaccine that they will buy for any country must be certified and approved or listed by WHO. So the WHO listing is that they will go and make sure that the vaccine has the quality it says, where they're manufacturing it is standard, it has all that is required for a vaccine manufacturing plant, and then the process of handling it is safe. So the WHO does not approve vaccines, but they list, so they can give you, because the virus is spreading, the wild virus is still killing people, so they use what they call emergency use listing. So now they will say, among all the vaccines that are available, which ones have met our requirements? So far as I'm talking to you, only 4 vaccines have met such requirements. The Pfizer-BioNTech, which is very expensive, which is mostly now used in America, and has a lot of logistics problems which we can't handle for now. Then the Moderna, which has been there, and then the last one is this AstraZeneca, produced in Korea and produced in India. So that means these 2 vaccines, even though they have the same origin, are now available for use through the COVAX mechanisms.
Right. So it would not be strictly correct to say the country went for just the cheapest.
No, not at all.
This,
yes.
Right. So let's go to the next stage of this. And would vaccination necessarily mean the end to non-pharmaceutical measures, and stemming particularly this COVID?
Yeah, definitely. Before I answer that question, let me just add that despite all I've said, the countries or regulatory bodies like NAFDAC we have must approve, must give that emergency use authorization for these vaccines to be brought into Nigeria. And so that's why they brought the vaccine, and even though they have given that authorization, they now still have to test it again. Now, to come into this your question, is that's the biggest question now worldwide, which many experts are just beating their heads to see if they can answer that. But the answer is so far no. There is no magic wand yet to say, oh, because you have been immunized, you are free. You can now remove the mask, you can ignore the social distancing, you may not wash your hands. It's not possible. The reason is that the vaccine is against the known old virus, type of virus, which is the one that started the pandemic. But unfortunately, from the time the vaccine is developed to now that we're talking, new variants have come out. And those variants are now having potency to be highly transmissible. Some of them are highly pathogenic. They are causing a lot of severe cases and deaths, more than the old one. So with that event happening, so you cannot say, oh, because I'm vaccinated, I won't observe this social distancing and pharmaceutical components to make sure that you are protected. But one thing is obvious: if you are vaccinated, the chance that even including the variants, that they will kill you or harm you is less, because the vaccine will reduce severity. That is shown already in UK, in Israel, and in America. So all those who are vaccinated will have less chance of dying, will have less chance of having severe cases, even with the new variants. But the fear is that the virus is still mutating, and that we pray a more deadly variant doesn't come out. So we are going to combine the use of the non-pharmaceutical protocols, where you sustain social distancing, wash your hands, wear the mask, with vaccination. So the combination of the two will give you fantastic result.
Prof, as you said, that's the crux of the matter. So many people would say, look, if I'm going to be vaccinated and I can't walk around and say, oh yes, I'm 100%. But in general terms, is there any vaccine that gives you 100%, immunity against infections? Is there any?
There is none.
All right.
So there is none. For instance, Brazil has vaccinated about 5% of its population. And as soon as they brought in the vaccine to Brazil, many Brazilians said, oh, finally, results, we have found solution to the problem. So people started, dropping their guards, started feeling free and all this. But in the last 1-2 weeks, there is upsurge of infection in Brazil and deaths. Yesterday, and the last 2-3 days, Brazil has recorded the highest number of deaths per day since the beginning of the pandemic. So you don't take chances at all.
Sometimes people confuse this, the use of vaccination and what is termed herd immunity. And it tends to be confusing. What's the relationship? People are vaccinated. Well, if you have 50 people in here and say 20 are vaccinated, does that bear any relativity to herd immunity?
Yeah, it does and it doesn't. Herd immunity can be acquired even without vaccination.
Right.
And that is if the virus is circulating in here, where let's say 100 of us, some will acquire the virus and become sick. Some will acquire the virus and become severely sick. Some will acquire the virus and unfortunately die. But some will acquire the virus and not even show sign that they are sick. You understand? Asymptomatic carriers. So out of the 100, you will have some percentage of us that will have the virus and develop antibody against the virus. Okay? So they will be safe. They will be protected without the vaccine, but they got the wild virus. Okay? So if that is the case, maybe out of the 100, if 40%, develop antibody against the virus, it will say they are near herd immunity. They haven't gotten herd immunity yet. But let me tell you what is the meaning of herd immunity. Different diseases have their own level of herd immunity. For instance, measles, when 60% of us are now protected against, the virus, that means our community of 100 have developed herd immunity against the disease. So even without vaccination, we can be protected against the something. But also, you can increase herd immunity by vaccination. For instance, if 40% of the 100 of us that are here acquired natural antibody, and then you immunize more people, or immunize us more. So the vaccine can boost our immunity level from 40% to 60 to 80. So that means we shall acquire enhanced herd immunity. So herd immunity is just meaning that the minimum level of antibody prevalence in that community, that can provide protection, community protection. That's the meaning of herd immunity.
All right. In some cases, in dealing with some diseases through vaccination, there are periods when a vaccine an individual has received is deemed to be still potent. Let's, for instance, vaccination against yellow fever and such, which is about 5 to 10 years. Now, in the case of vaccination for COVID-19, is there any known duration that one who is taking the vaccination, it can be potent for maybe 1 year, 2 years, or 5? And that's one part of the question. The second side of it is how many doses would an individual need to take? We've heard in some cases some of the vaccines used in other parts of the world, for instance, they say 2 doses. What is the situation with AstraZeneca in Nigeria?
Well, starting from the first question, is that, how long will the vaccine provide protection after you have been immunized?
Yes.
So, nobody can answer it as of today because it's a new vaccine, it's a new disease. Nobody knows how the antibody level will last, for some times. Therefore, it's all speculation. But we have some information. When somebody acquires the wild virus that can lead to disease or you not becoming sick. They have now seen that those who suffered from the disease and survived, the antibody level in them can last up to 8, 9, 10 months before it starts waning down. So which means, we have some information that the immunity can last for more than 10 months, near 1 year. But with the vaccine level, they just started immunizing, and most of the immunization, started maybe around, March, April last year. So we are getting to about 1 year now to see how long it will last. We don't know exactly how long vaccination against COVID-19 can protect. So the yellow fever, initially they said it was 5 years. Then part of our team, international team, I was part of it, we did the job, and we realized that it can last up to 10 years. But when we had the outbreak, in Benue in 1986-87, and then in Ogbomoso 1987-88, we now found that there are some old people who we took their sample. We did neutralization tests to see if they still had antibody. And some people vaccinated 40 years ago, 60 years or 30 years ago, were still having protective level of antibody. So we now wrote to the WHO, definitely yellow fever can proffer protection for more than 10 years, and it could be even life. So if you are immunized against yellow fever now, you can remain protected against yellow fever for life. But the WHO could not say, oh, that is life. So say, no, let's use minimum, that after 10 years, especially if you are living in an endemic area for yellow fever, you are now eligible for another yellow fever immunization. So, but some of the vaccines don't have such a long time of protection, long lifetime for protection, like the flu vaccines.
Right.
Flu vaccines don't give protection for too long. So that's why you need to repeat some of the immunization 2, 3 years, and so on and so forth.
Right. But for the case of COVID now, would it be just one dose to give this protection for a period which is unknown for now, or two? In some parts of the world, it's spread between several weeks. You take a first dose, you take a second. What's the position here?
Well, we are using AstraZeneca, and AstraZeneca has recommended that you need 2 doses to be fully immunized. So if they give you 1 dose, that means you are partially immunized. You will develop antibody response, but if they don't give you the second dose, after some few months, the level will wane down. So now the second dose is to will serve as a booster.
Right.
So if that is the case, you need 2 doses. But some vaccines, like the Johnson & Johnson, you require only 1 dose. Why? Most likely, what they did, they took the vaccine and put an adjuvant. So if they give you once, and you don't need to get any booster again. The vaccine will be released gradually, and then it can last even longer. But good news is that even the Pfizer, BioNTech are now saying that they are developing new type that will also be just a 1 dose.
But AstraZeneca really 2 doses.
Yeah, 2 doses.
Now, well, you're vice chairman of the FCT COVID-19 committee. Doesn't that, give an extra challenge? Talking about logistics, you would now have to make sure that those who have received the first dose, and be certain that after the prescribed period of time, they would come back for the second dose. How do you surmount that?
Well, that's a challenge faced by most countries, even developed countries like UK, that have done very well with this vaccination. They realized that, one, it was not easy to give just 1 dose and ask the person to come in 3 weeks. Why? Because it's not very economical for them. You will need more vaccines in that case. For instance, Nigeria has 4 million doses now. If we say we are giving, we are going to fully immunize Nigerians with that 4 million doses, that would mean that we can immunize only 2 million Nigerians, which is just about 1.25% of the target population we are looking for. But because we want to get more people, and we are right, that's the right decision, we are now going to immunize the 4 million, and then wait and expand the time that we need to get the second dose. And that's what we are thinking, that the best thing to do, immunize with the 4 million, and then get the second dose to come after 12 weeks.
Okay.
But the recommendation by the company is after 3 weeks. Even UK, they said, oh, listen, yeah, the company is recommending this, but we can look at it biologically and technically and clinically in our own country and come out with a different approach. And that approach worked. So we have something to rely on, the UK experiment, which is working. So, and lastly, the logistics of handling the vaccine has been made easier for us by our experience from the polio and other meningitis vaccine, polio vaccine, and so on and so forth. So this, we are banking on this to actually, reduce the pressure on the logistics of immunization. For instance, in the FCT, we have enough storage volume to store these vaccines. We have already many trained health personnel to handle the vaccine. MPSDA also carried out a lot of training of healthcare workers. So Nigeria was well ahead to some extent, that at least we're a little bit more ready.
All right, we'll return to that in a moment, but let's expand this, talking about those who are eligible for this vaccination. At least Nigeria, it's been decided that people from 18 and above, for now, and pregnant women are exempt for now. So I am pushing the frontiers. Pregnant women, what about women who are breastfeeding?
Well,
if there are, concerns about women who are pregnant, shouldn't that extend as well to those who are breastfeeding? Because most drugs that we see that they give cautions about using them for pregnant women is usually extended to breastfeeding.
Yeah. You're absolutely right. But you see, luckily, all the vaccines that are used, except one that is live by the Chinese, which is not yet very popular, all of them are either kill vaccines or subunit vaccines to this protein. So all these ones can't harm pregnancy because they are not live vaccines. You understand what I'm trying to say? But because nobody has done clinical trial to see if really there could be some side effect on pregnancy, that's why we are, the WHO and others are very careful. So here I can say, any pregnant woman that is in front line, for instance, a healthcare worker,
right,
or a pregnant woman that has a husband that is infected, or somebody is infected in her family and all this thing, should be immunized because it's safer. The risk of not immunizing is much higher than getting her immunized. You understand? So by that, we say every pregnant woman should be individualistically, assessed to see whether she can get the vaccine or not. So it's not that the vaccine is banned, for pregnant women. No, not categorical. Then the issue of breastfeeding. Most of the time, if the virus or the disease is not passed through through the milk that the baby will suck and so on and so forth, there won't be danger. Some are, especially the live vaccines again.
Right.
So again, the WHO and most countries are very careful. No clinical trial yet, fully, so nobody can categorically say it is safe. But nevertheless, also breastfeeding woman that finds herself in a risky situation and the risk not to be immunized is higher than to be immunized, we recommend that such a person should be immunized.
But you'd rather go for an assessment, individual assessment first, before determining.
Exactly.
Now it brings us to the other side. The recommendation is 18 and above.
Yes.
That might well suggest to some young persons who are 18 below, below 18, that, we are not at risk. And couldn't that in any way lead to what one might tend to be careless behavior?
Yeah, you see, you have to check why did the WHO and other health organizations come to that conclusion that, let's face this group, 18 and above, and get them quickly protected. And, not because we're ignoring those 18 and below. From all countries, and the experience that we found is that those who suffered more from the infection and the disease are those who are above this age, particularly above 50. So if the youth can fight the wild virus more and they can survive more, survival rate among those who are 18 and below is much, much higher than survival rate among those who are above. So now you don't have enough vaccine to immunize everybody. You don't have the money to even buy and fund the logistics if you are to immunize everybody. You don't even, have, how will I say, the manpower to be able to do it quickly. Why? Because if you say we are going to immunize everybody quickly and get 100% immunized, then there will be pressure on the routine immunization. And then it can also affect it. You don't want that to happen. So we said they are now doing, say, let's do selective immunization. Let's start with the group that are most affected. So that's why they are starting with the group that are, 50 and above, particularly, and then subsequently 18 and above.
Well, Prof, then the other category of people who are eligible. Now, along the line, some people have contracted COVID-19, some have survived. Unfortunately, some have lost their lives. For those who have survived, and some virtually went through it without any symptoms, without falling sick, and they just got well. For those category of people, are they also eligible for vaccination? That's one bit. Another bit is, it's quite possible that there are people who are asymptomatic. They have contracted the virus, but they don't know because they have not taken ill. Probably they haven't gone for any test. Could there be any repercussions for vaccinating such people who already
have the virus?
Yeah.
So it's a very tough question, but as I was saying again, it should have been as if somebody has the virus, the wild virus. Then you take the vaccine virus and you are putting it in his body. So you are now putting two live viruses in the same body. But we are lucky. Almost all, if not listeners of the anti-COVID vaccines are not live viruses. They are either killed viruses or they are just particle vaccines. So there is no visible harm to actually immunize those who have already survived this disease that we call COVID-19 survivors, or those who are healthy carriers. There's no harm. Secondly, it's cheaper to immunize blind, because if you say you will test before you immunize, you are adding additional cost, into that, preventive activity you are bringing to your country. So since the vaccine is not known to give any serious adverse reaction, it's cheaper to really get all in this category immunized than to say you will descend. Then lastly, is that those who have been sick, who had the virus, who have survived, they have a particular level of antibody. But that antibody is caused by the wild virus. It doesn't last very long. Earlier I said it lasts between 8 to 10 months. Yes. If you vaccinate them, the vaccine you are giving them will now serve as a booster. Such people might need only one dose. And then they will be boosted and they will be fully protected.
Okay.
So it makes sense to vaccinate them.
Those who are not sick. What of those who are currently undergoing treatment for COVID, who are sick, who are either in hospital or who are in the process of being treated?
No,
managed.
Preferably, you don't include sick people in your immunization. Right. You have to get them out when they are okay and listen. You don't give somebody that is ill vaccine.
So let's see how this works out. An individual, Mr. A, comes and says, look, I'm due for vaccination. You would want to find out from them if they've had the disease before, if they've been treated, if they're undergoing treatment. These are questions you could ask them.
Yes.
Okay.
Yeah.
And so depending on what answers they give, you now determine whether they need the vaccination at that time or not.
Yeah. But usually, if you have a vaccination point, by the time you are coming to that point, you have been screened. You have been screened. So, for instance, the website that MPCD established, they ask you questions, including have you been ill and this, are you health worker, you are not health worker, why are you now, all this information are vital information that are required for decision making. So, but for a case, let's say in the rural areas where they can't access the website and all this thing, if you go, you are right, you ask all these questions. But there, even if somebody had fever, he had difficulty breathing and all this thing, maybe he has not been tested in the lab. So you can't categorically say this guy has suffered from COVID-19, and then, maybe he has antibody or maybe he's having the virus, we are not going to vaccinate him. So you see another difficulty. So that information that is, how will I say, lacking, paucity of information will now make you decide, oh, listen, I will go to an area where, I want that community to be protected against this virus. So I won't be so bothered if somebody has suffered from the disease before or not, and then if somebody is carrying the virus. All the vaccinators will care is that you are sitting there, you are healthy, you are not running temperature, so they can vaccinate you.
Okay.
Yeah.
Now, still with this vaccine, the choice of vaccines, there are some countries that have approved the use of more than one vaccine. Now, in Nigeria, as we all know, AstraZeneca has been the chosen one. Mm-hmm. Is there anything that says at some point in time there won't be other vaccines, or is the use of AstraZeneca is it, as they say, cast in stone?
Definitely no. And luckily, no. Because as I'm talking to you now, countries that are already using AstraZeneca have other vaccines. One, the decision to choose which vaccine you want will be dependent on your pocket and ability to actually go to the market and buy. That decision, if it's to be made for you, that means you are a donee, you are somebody who is a recipient of donation, then others will make that decision for you. Now, the next is, we are now having AstraZeneca. Johnson & Johnson have applied to WHO for emergency use listing. If they get it, COVAX, that is that multilateral organization that has given us AstraZeneca, will send Johnson & Johnson to us.
Okay.
COVAX was to send Pfizer, BioNTech to us, but there was some logistic problem. So we'll have actually Nigeria ended up with, Pfizer, BioNTech, AstraZeneca, and then Johnson & Johnson.
I recall the Pfizer thing, and it led to so many speculations about the reasons, and in fact, some people went as far as saying that WHO actually denied in Nigeria the Pfizer product, but this was later debunked. So you as a professional, and I mean, clarify this for us. Is it possible that in a pandemic such as this, the World Health Organization would deliberately discriminate against any country and say, no, we're not going to send the vaccine to this country because we don't think that we should send one? Is that a...
It's impossible. For instance, every country, I will answer that one specifically now. Every country can decide 5 types of vaccines immediately if they have the money. And many countries are doing it. Canada is doing it, US is doing it, Indonesia, many countries. You understand what I'm trying to say? So it is, for instance, Nigeria, as I'm talking to you now, are already negotiating to buy the Sputnik 5, the Russian vaccine, to bring it in and for use. So we might end up with, AstraZeneca, Johnson & Johnson, and then the Sputnik 5. When they come, we use them as if it's their, individual anti-COVID vaccines freely. That's number one. Number two, the last point you raised was,
if the WHO would deliberate, is it plausible?
I think WHO is the last point that protects humanity from anything that can harm human being. So WHO can never discriminate against any country. In fact, these multilateral groups are brought to protect us. That, hey, listen, you developed countries, you can't immunize yourselves and then leave the underdeveloped countries without the vaccine. That will mean nothing. If the world is not fully protected, nobody is protected. So now, but WHO has criteria which you have to meet. They can't just bring the vaccines and dump on you. They will say, hey, listen, we have vaccines for you, but you must have good cold chain. You must have enough transportation to move the vaccines around. You should have minimum requirement of number of people that can do the immunization. You understand what I'm trying to say? And you should be ready to either, do guarantee the safety of the vaccines we're bringing to you. So maybe at a time, if Nigeria or any country doesn't meet that criteria, you understand, they'll say, oh, sorry, we can't give you the vaccine now until you meet these criteria. We planned, I'm going to give you 20 million doses. So we're ready to give you, but when we came, we saw, oh, sorry, you are not ready. We shall give to other countries that are ready. When you are ready, then we give you. So maybe that could have happened, but that doesn't mean that Nigeria was discriminated against or Nigeria did not meet the criteria.
Safety is the catchword here, and I suppose in all of this we've been talking about, the biggest issues discussed all over the world, it's not particular to Nigeria, is whether the vaccine is safe or not. And so far, world leaders have stepped up to take those vaccines to at least show by example that they are taking it, and so they believe they are safe. Let's talk about the safety of those vaccines, particularly for a country like Nigeria, where you still have so many people skeptical about vaccination.
Well, in the world, there are some of the few safest vaccines you can rely on at any given time. And I'm happy you mentioned one of them, that's yellow fever. It's so safe that, you know, even if you have any untoward reaction, it will just be others local, light or mild fever or temperature, etc., and so on and so forth. So all the experiments carried out so far by various countries on these new novel vaccines that are now being used to fight COVID have shown that they are highly safe. They are very, very safe indeed. Safety in which manner? That virtually, as I'm talking to you now, 347 million people have been immunized worldwide against COVID. At least have received one dose against COVID. And about 73 million have received, are fully immunized. And none of these have actually come with serious reactions or untoward reactions that we can say, oh, these vaccines are not safe, we should stop it. If you remember, there are some few countries that say, oh, some people died after immunization, some people, so now they are saying some people are developing clots after immunization with AstraZeneca. But that has not been proven because UK has immunized about 24 million people. And none of the people there are coming down with this clotting and so on and so forth. So as far as WHO is concerned, and most regulatory organizations of different countries in the world, the vaccine is safe. It's better to have it. Don't wait until the wild virus hits you. So if there's anything at all we can guarantee is that no country will allow an unsafe vaccine to be brought in to actually get their people immunized. Then lastly, all regulatory bodies that are working to protect us from dangerous medicines, dangerous vaccines, are up and doing that. When the vaccine comes, like you remember when after AstraZeneca came into Nigeria, the last thing that was to happen was NAFDAC will go to where the vaccines are, pick samples at random, come back to NAFDAC and to laboratories and make sure that, one, what the manufacturer says is the component is correct. Two, there is no any particle in that or any substance or something in that vaccine that can harm our people. Then three, there's the simplest test they do, that you immunize, guinea pig or this thing, to see if there's any outside particle that can cause a reaction. If you give such animals, within a few days, they will develop temperature. They will have fever. So if you remove toxicity, remove contamination with other particles, including viruses, and you guarantee that the component as described by the manufacturer is what you are seeing, then you allow your people to be immunized. So that is the safety part.
So right now you can categorically say that this vaccine went through all the measures by the regulatory bodies we tested. And therefore, when reports go around the world saying people took a vaccination and they immediately died and all that, these have not been directly linked to just the vaccination, or people could have died from any other
There's what we
reason.
call causal association. Let's say how many people smoke cigarette and how many people develop cancer of the lungs. So if you do epidemiological survey, you'll be able to establish is so cigarette smoking actually linked to development of cancer of the lungs or not. You understand what I'm trying to say? So now all the surveys have confirmed that the causal association between cigarette smoking and cancer of the lung is very strong. It's more than 80–90%.
Right.
So that it is. Now, as far as this one is concerned, if you immunize 1 million people, within that particular period you are immunizing 1 million people, maybe their time have come. Some people will be, you are immunizing are destined to die or around that period. So if somebody dies after immunization, you have to establish that he didn't die from other causes, not because he's being immunized. Because anybody can die even without the immunization. So some of the deaths reported so far, I don't think there's 1 or 2 or 3 that have been associated with the vaccination directly. So the causal connection between vaccination against COVID and immediate sudden death is not holding water.
Professor Nasidi, for now, vaccination is voluntary to a large extent, so people can decide that they want to. They have been encouraged to take it. Do you envisage a situation in the future that it will become mandatory?
Well, this is another tough question you're asking that many countries are not even able to answer. So, like for instance, there's a situation that will say zero COVID. Zero COVID. Is it possible to attain a situation whereby the world doesn't have cases of COVID anymore? We have now smallpox, zero smallpox, no smallpox in the world. Many countries have now eradicated polio. Polio is zero polio. Is it possible if we use this vaccine, we can knock off, COVID out of human race? So that situation is not yet possible to to establish. So we don't know how this will play out, and therefore we cannot categorically come and say, because the vaccine is available, we have found the final solution. In fact, the vaccine is available. If we make a mistake in dropping our gas and thinking that, oh, finish, we have found the solution, we might be surprised because many things can happen. Our gains can be reversed, the virus can change, and it can now come even more vicious, or we can be lucky that the vaccine has worked and reduced the cases. So now, even though immunization is going on, cases are still surging in some countries. So it is not a straightforward business to say that it will be possible for us to have the zero COVID situation,
but
not in the nearest future.
Yeah, but people could be compelled at some point in time, because the last time the PTF chairman was advising people to present themselves for vaccination, that it might well be some of the countries may decide that you don't come in if you can prove that you have been vaccinated.
Absolutely.
At least we have seen some countries turn back Nigerians on account of yellow fever vaccination.
Yeah. So actually, the issue of being compulsory, that's what I was trying to explain, will come up only if, I'll give you an example, to say the whole of Europe is fully immunized. Africa is not immunized. And the Europe can say nobody comes from Nigeria except you are immunized. So Nigerian government will not like being embarrassed. They can say anybody traveling outside Nigeria must show evidence that he has been immunized. So that's compulsory immunization. But to wake up and say everybody in Nigeria must be immunized and you are making it compulsory is not yet possible. Okay.
Professor Abdulsalam Nasidi, it's been interesting talking to you. Thank you for sharing your thoughts with us on this vaccination. Thank you for coming in one-on-one. Thank you.
Thank you very much, Cyril. As usual, I'm happy to be here to talk to Nigerians through you. Thank you very much.
Thank you.
Yeah.
Well, and that's our program today. We thank you for watching. Next week, we'll be back with one-on-one. I am Cyril Stover, and I say continue to stay safe.